Okay, so this video is for knee rehab when it's in a non-weight bearing stage, okay? And so during this, goals are maintain hip strength and mobility, and also starting to kind of rebuild the strength around the knee, flexors and extensors. All right, so first exercise is going to be a straight leg raise. You can lean back, lock the knee out, raise up. This gets harder the more you bring your chest forward. You can also go a little wider to get a different angle and raise up. You can kind of play around with the position. It makes it even more effective. You can mess with the length of the contraction and also the direction that you move the leg. So we don't have to just go up and down. We can hold. We can go side to side. We can go circular. All of this is working our hip flexors. So next thing we're going to do is hip abduction. Do that sideline. Lay here with this leg, reach a little bit. See, it's a small movement, but I reach, make sure the heel stays level with the toes, so I'm not like this, right? Heel level with the toes. Let me kind of show that from this angle. So I don't want to do this. I want that. Reach out a little bit, turn the heel up slightly. Shortens the range of motion, but it hits our abductors more precisely. All right. Then bring the knees up, not to 90 degrees, maybe about 45. Do clamshells. Again, working abduction. I don't want this opening up. Stay facing forward and just open up at the hips. All right, clamshells. All right. Next thing, you go in a chair. We've worked flexion. We've worked abduction, moving the leg out. Now we're going to work adduction, ADD. All right, that's bringing the legs in. Put something soft in between your legs. Squeeze. Again, we can pulse, squeeze, rest, squeeze, rest. We can contract for longer, squeeze for 10 seconds, and then relax. Kind of change it up as you see fit. All right, also in a chair, you start working the knee extensors a little more by starting with the leg back, bringing it forward. Again, you can hold, pause, lower, slow, pause, lower, slow. You want to control the movement as much as possible. You don't want to just kick out, okay? Keep control. All right. Another thing we can do, we're going to work our knee flexors. And lie down, face down, pull the heel towards the butt. All right, you can try to squeeze, pull it as far as we can. Carefully don't cramp. Can also have a partner hold our foot down and provide just enough resistance against that pull up. Or if we have a setup for it, we can place a band connected to the ankle, pull the foot up that way. Or use an ankle weight. Any way you can get extra resistance, do it. And last one, if you're ready for it and can bend your knees, we can do a bridge to also get the glutes and hamstrings back here. So lay down, push through the heels, bring the butt up. We want to focus more on squeezing the glute than extending at the back like this, all right? So it makes the movement a little smaller, but again, it hits the muscles that we're trying to target. So here, squeeze the butt, down. Squeeze the butt, down. And as you progress and can keep this position without any pain, remember, no pain during any of these exercises. You're still recovering, and we want the tissue heal, and we don't want to irritate it. All right, but as you progress, you can hold, you can march, you can do one leg, and then finally, when you're getting close to being 100%, take a ball right here, pin it against your stomach without your hands, just using your leg here. Pin it there, go up for 5, 4, 3, 2, 1, come back down. All right, so that should get your leg moving in all the planes of motion, as well as your knee. So you want to do at least 3 sets of 10 of each of those exercises every day. Really important, early in the rehab process, we maintain as much muscle as possible, all right? And slowly build reps and intensity by adding any resistance you can, all right? Okay, good luck.